Yes.
Good.
Okay, and let me introduce Julie Donovan, the Advanced Care Planning Facilitator for Peace Health, and I will turn this over to her and let her begin.
Great, thank you. I'm so happy to be here. This is a topic that's very near and dear to me, and I love talking about it. So I'm always glad that there is an audience willing to hear about it. So thank you. I'm going to go ahead and share the PowerPoint that we have. Let me make sure I share that. All right. Can everybody see that?
Yeah.
Okay. And before we start, just to let everybody know, I welcome questions as we go along. As Mary Lynn stated, sometimes it's really hard to remember what you meant to ask earlier. So please interrupt. I'm happy to have those questions, whether you ask them out loud or in chat. Um, and then again, before we start, how many people here, I mean, if a show of hands is possible, if you have your cameras on, have their advance directive done? Oh, okay. That's pretty good. Nice. Nice. Thank you. So, we call our talk about this, your voice, your choice. And we think it's really important that people have their own voice if they want, to. Some people don't, but to be able to share what you want or don't want for your health care. So we like to help facilitate that um, through this information. Here, all right. All right, so the form we use is actually originally published and put together with the Washington State Hospital Association and Honoring Choices Pacific Northwest. So it is a state of Washington form. One thing to know about it is that it can be revised at any time. This form is designed for people who are 18 and older. And it is a living form, meaning that it is meant to be changed and updated as we live our lives and things change in our lives. You can use a pencil on it if you want to keep your original. You can make notes, and you can write anywhere on this form that you want. Wherever there is white space that somebody could read, you can attach papers to this. Whatever you need to do to make your wishes clear. All right. We're going to talk about advanced care planning and why it's important. We're going to talk about reflecting on values and personal beliefs, selecting your healthcare agent. So if you already have yours done, this is just a really good time to kind of review what you already have and see if there's any changes you want to make, including healthcare agents. How to express your wishes in a legal document, and how to share and store the document. And that is not in a safe deposit box, just as the first note. There are people who do store it there, and it's really hard to find access when you need that form. So what is advanced care planning? It is the process of thinking in advance about the care we would want if we have a serious medical event or condition, and deciding who would speak for us if we could not speak for ourselves. And it involves creating a plan, putting that plan in writing, and sharing it with those who have some investment in our care. So advanced care planning has three pretty distinct parts that all work together. One is the legal documents. So the advance directive, which includes your durable power of attorney for healthcare, often referred to as your healthcare agent or power of attorney for healthcare, and or a living will or healthcare directive. So you can have one or the other or both. So the durable power of attorney for healthcare is the who you choose to speak for you if you can't speak for yourself. And the living will or healthcare directive is the what. What do I want or not want? What's important to me? Those are the legal documents. The legal part of that is that durable power of attorney for healthcare. Then there's medical orders. The POST, which is the portable order for life-sustaining treatment, or the DNR, do not resuscitate. And if we have a couple here. Does anybody have a question?
I have a question, Julie. This is Julia.
Hi,
Um,
Julia.
I was wondering if you could just outline regarding the durable power of attorney, what the hierarchy for that is in Washington State. For example, if you have not reevaluated that and you've designated a certain person, because I know there is a hierarchy, who makes those decisions in Washington State. I don't know how much that differs from state to state, but also addressing if that's honored in other states, because a lot of people spend time in other states or maybe
Right.
go somewhere so can you address that issue?
Yes. And we will go through the hierarchy.
Okay.
The durable power of attorney for healthcare designates the person you choose to be your voice if you are unable to speak for yourself. That that is really number one, unless there is a situation where there's a court order for something. But durable power of attorney is best case scenario. It's where you are choosing who you want to speak for yourself. And really that's what we want. It makes it easier for your healthcare team. It makes it easier for family. And we will go through the hierarchy because there are, each state has one and they do differ a little bit. But the hierarchy only comes into play if you have not completed a durable power of attorney for healthcare. So thank you for asking that. And we will go into detail on that hierarchy. And with a living will, healthcare directive, and durable power of attorney for healthcare, how does this work when paramedics arrive? That's a really good question. Thank you. So paramedics, the only thing they are looking for is a POST, the portable order for life-sustaining treatment. In Washington State, we're going to go through this in a little more detail, but in Washington State, that's the bright green form that people complete when they want to limit healthcare provided outside of the hospital. So typically it's when somebody chooses not to have CPR. And that is the only form that paramedics can follow out in the field. Does that answer that question? And we will go into more detail in a little bit too. Oh, yeah. So how does one get a POST? They get it from their physician. So a POST, as we'll talk about later, has to be signed by both a doctor, nurse practitioner, or physician's assistant, and you as their patient. So it is a medical order. And sometimes physicians or clinics will give them out blank. It is really meant to be reviewed with a healthcare provider. And if they don't, you can actually ask for an appointment to do that. That is covered under healthcare insurance, that time. So the third part of advanced care planning is the conversation. And I would say it's equally important because you can have an advance directive, you can choose your durable power of attorney for healthcare and never talk to that person. And that comes up in the hospital quite frequently, where somebody at the hospital makes that call to the person that was chosen as the durable power of attorney for healthcare. and that person has never had a conversation about healthcare with the person in the hospital. And at the time that that call is made, the person you choose can decline to be in that role. So there's been instances where somebody chose a neighbor and the neighbor didn't have any idea. Any case scenario like that. Or that somebody just feels like, oh, they just can't step into the role. They don't feel able to make those decisions for that person. So we'll talk a little bit more about what are we looking for in the person that we choose? And then how do we let them know what we really want? Okay, John, you want to know how the pulse is communicated to paramedics? The form is, if it's in the home, the form is usually on the refrigerator or near the person where they spend most of their time. It isn't always clear cut. You say, I've seen them try to revive a code blue resuscitate, which is not what the client wished. If there is like a bad car accident, something that happens outside the home, they're focused on getting somebody out of danger first, and then they will do a cursory look for any form that you may have in a purse or wallet, or anything that would prompt them to look for a pulsed form on file somewhere. So it's not always clear cut, but in the home, they always look for the pulsed form. And I'm sure that there's always situations that happen where somebody doesn't wish to be resuscitated, and they are. We are really, really trying to minimize the opportunity for that by getting this information out and making sure that the people involved, or the people who wish to have a pulsed form and limit that care, know how to share that information. The state of Washington is actually trying to get a pulsed registry working. Oregon has one, but Washington does not. So the Pulse Registry would really make that a little bit easier.
If I can add, that legislation was before the legislature this session and did not move out.
No,
Not passed.
not passed. And it was passed years ago, but never funded. And so they went to pass it again. And I mean, a lot of people wrote in, a lot of people really worked hard to try and get this passed. And it really is a critical movement, I think, for all of us, especially for those of us who are aging, to have that on file. That would make it so much easier for hospitals and emergency medical teams to be able to pull up. So hopefully we'll be able to keep working on that and get that done. All right, so what is an advance directive? So this is just a picture of the advance directive that we use. It's one of many that is legal in the state of Washington. Washington has a list of advance directives that people can use. Oregon has much more narrow choice for directives. Peace Health started using this directive because it's only 4 pages. And it's a little bit easier for people to fill out. They can definitely add pages to it if they want to be, they want to add more about exactly what they want. But this at least gives the who and the what to help prepare a healthcare agent. So this is what the first page of the filling out part of the directive looks like. And you'll notice in yellow at the top, it's circled, and it says page 1. The writing is very, very tiny, but they do put the page numbers on that because these get separated when they're scanned into records, and they want to make sure that they have all the pages and that the pages belong to the person submitting them, that they're all the same person. And so you will also notice at the bottom of the forms, there is a space, this around here, there is a space to put your name and date of birth. And that's one way that they have of checking that all the pages correctly belong to the same person. So this is what the first page looks like. The top part of the information is just your name, your date of birth, and pronouns if you choose to fill that part out. And then the naming of a healthcare agent. This first one is the person I designate as my healthcare agent. So this would be your healthcare power of attorney. Then there is a space for 2 alternates. You don't have to fill that out, but it is there and available if you want to have backups for that. And those people would only come into that role if that first person could not accept that role or chose not to accept that role when they were called on. Maybe a question in here. Oh, John, is there an ID bracelet that one can wear with the post information?
No.
A healthcare directive not to resuscitate. So do you have a post form, the bright green form, John? If you don't, that would be the next.
What was the question? What was your response? I didn't get it.
Oh, do you have a post form?
I don't have a bracelet, but I'd like to. There must be some identification I can wear to let paramedics know very easily that this is what I want. I have been through this many times where we do a cold blue and bring someone back and they're really ticked off because they didn't want to come back. They, at that point, it became a major problem for their families. They were really totally disabled. They had other issues. So it magnified the impact on the whole family.
Yeah.
So, if there's an easy way that we can identify this, paramedics have to do what they do. And they don't, people will often pick up a phone because that's normal. I see Alice suffering, so I'm going to call the doctor. I'm going to call 911. So they call 911. Folks show up and they do what they have to do and, put Alice through a really tough event.
Right. We're doing a lot of education with emergency responders about the post form. A medical bracelet can help. They can't follow what the medical bracelet says, like DNR, but it would prompt them to look for that form. So they can't. I've had questions like, can I tattoo DNR on my chest? No. I mean, it might prompt them again to look for a form, but the only form they can follow outside of the hospital is that bright green physician's order for life-sustaining treatment. So if you do want to limit care, and by the way, you can make as many copies of that form as you want. You can carry it with you. There are wallet cards that are included in this directive that we're reviewing today that you can cut out and put in your wallet. So there are other ways to let them know, for sure. It doesn't prevent all instances, but it would help. And there's many companies that sell medical bracelets, and you can put on the bracelet whatever you want to put on that. All right, so back to page 1. This is page 1. This is what it looks like. It's pretty straightforward. We'll go into the bottom part in just a moment. I have a short video here about, this is from Conversations Project, and it's about choosing a healthcare proxy or your durable power of attorney for healthcare. And I will share.
Be your healthcare proxy? Like if you need someone to tell the doctor what to? I just go with whatever the doctors say. I wouldn't want to bother them. They're so busy. Doctors know best, right?
Be your healthcare proxy? Sure, I'd be happy to. If I'm in town, check out my Instagram pics from Peru. Wish you were here.
Oh, I could never let you go. I can't even throw a plant away. As long as it's got one little green leaf. I'd be like, can't we upload her to the cloud?
Well, heck yeah! I've given this a lot of thought. Let me tell you what decisions you're best off going with. You never let them resuscitate. And if they even try to hook you up to one of those breathing machines, never. I got this. I totally got this.
How can you even talk about this? I can't, okay? I just can't. Mom, it's not like you're gonna die. No, I can't talk right now.
Oh wait, did I show you that meme from iFunny? The cat and the dishwasher? Oh my gosh, okay. So the cat's like, bleh. And then he's like, wah! Oh wait, sorry, what?
Well, hon, you and I have been through so much together. Here's what we'll do. We'll sit down, we'll get a cup of coffee, and you tell me what matters to you.
Well, it wouldn't be easy. I mean, I'd be sad, but I'd have your back.
I remember when we went through this with Mom, we really spoke for her. So I think I can do that for you. Let's talk about what you would want.
Any comments on that? Does that prompt any memories from people deciding how they were going to choose their healthcare person? Get past that. So it is really important that the person you choose actually can kind of step into your shoes. The goal would be that you have enough conversation, they know what you want well enough that they really are kind of your agent. They can step into your shoes and have the bigger picture of what you would want or not want. So there are some requirements. They have to be at least 18 years old. I remember when I talked to my adult children and one was 18 and he said, don't worry, I can have that role. I'll take care of you just fine. And I thought, that's not the person I'm choosing. They cannot be your physician or physician's employee unless they're family. And they cannot be the owner, administrator, or employee of a facility where you live or receive care, again, unless they're family. And then some qualities that we are really looking for in the person. They need to be willing to fill that role. In Oregon, they actually require that the person you choose sign your form. They don't require that in Washington, but having that question asked is a really good question. Are you willing to fill this role? Could you stand in for me? Could you do what I want or not want? Maybe not easily, but to honor it. And are they willing to talk with you about your values and wishes? Are they willing to follow your wishes even if they do not agree? And are they able to make decisions in stressful times? And often, right, we're called to be a healthcare proxy or healthcare agent, typically in times that are stressful, emotional, and there's always, everybody has opinions, right? So you're trying to get all the information from the healthcare team, and you're probably getting information from family. You're stressed out because it's somebody that you love and care for. Friends always have opinions. And I am going through this right now in my own family with my parents. And it is amazing the information that is lovingly given, but everybody has thoughts on what should happen. So just making sure that somebody can kind of weed through that and they're able to be in that role. Any questions on that?
Julie, if I can just add a comment.
Sure.
Do you ever, I'm not sure the right word to use, but do you ever encourage more than one? Because I know that even if someone has these qualities initially, in the moment, as it turns out, they may not be able to make those decisions. So having a second and third person on board, kind of allowing the person to either discuss with them and guide them, knowing the person who they're advocating for, or maybe having the option of stepping back and letting that person, because I know there's several places on the form that you could assign it, and then you're going to talk about the Washington state laws. But I'm just wondering if that's encouraged for that reason, because it can happen. It can happen.
It is very encouraged. If you have where those alternates are on that first page, I highly encourage that if you have somebody to name, and we'll talk about instances where maybe somebody doesn't have anybody that they think they can name. But it does offer that. And sometimes maybe you have somebody who's your healthcare agent that you've chosen, and they live out of the country, and maybe it's going to require travel. And then there's backups. You know, while a lot can be done by phone, there are times that people are out of communication, and having backups there is really helpful. And whatever you are sharing with the person you chose, you should also share with the people you've listed as alternates as well. They should have the same conversations, because you never know when you might need that person to step in. So thank you for asking that, Julia. It is really important. So if you have the opportunity to name alternates, I highly advise doing that. Best case scenario. Yeah. Does anybody else have any questions on this part? Okay. So this is what happens if you don't select a healthcare agent. This is the hierarchy of decision makers for the state of Washington. The first one on that list is a guardian appointed by the state. So that's a special legal situation. It doesn't come up all that often. So unless somebody has a guardian, it's not something that we need to really look at. The next one is your named healthcare agent, who's named on that advance directive. That is what we're talking about now, making sure that's completed and on file. But if you don't have that and you haven't filled out an advance directive, the next would be your spouse or registered domestic partner, even if you're separated. And we have seen situations where somebody is going through a divorce but hasn't changed their advance directive. And that person would be, you know, if they're the named healthcare agent, they're still the named healthcare agent. Or if you haven't filled one out, they're next in line. And then your adult children, followed by your parents, your adult siblings, your adult grandchildren, adult nieces and nephews, adult aunts and uncles, or friends that meet certain criteria. And you will see that asterisk after some of those categories. That means that any group that has more than one person, everybody in that group would have to agree on the care.
Oh.
And I don't know about any of you, but I actually get along with my siblings. But I can tell you that when it came to a stressful time, having to make decisions on, you know, life support or any of that, we would differ on the details. We would differ on timing. We would differ on how, or even how long, or where they should be. So that is, if nothing else, that is such a good reason to get your healthcare directive done. This is one of the reasons that hospitals have ethics departments called in. It's one of the #1 reasons, because children can't agree and healthcare is delayed, or healthcare ends up being provided for something that person would never have wanted. So very, very critical, and every state has these. Okay, so the question is, what if there are 4 adult children as agents, requiring them all to be there before taking off life support, and one cannot get there for 5 days? Well, most of the time, we don't recommend that 4 children be named as the agent. So your primary healthcare agent, durable power of attorney, really should be 1 person. So in my family, I am named as the primary. My siblings are named as alternates. The conversations have happened with all of us present at the same time. Yeah, so it having 4 named as a healthcare agent presents as many problems if they're all named as the main healthcare agent. You can, You're not prevented from doing that, but it presents some other issues that can come up. And Michelle asks, for some people, it may be important to list those folks that should not be involved in decisions. Yes, we will get there on what's important to me. That is very true. I have filled out more than one, helped somebody fill out more than one directive that names specific people that they did not want involved. Thank you for pointing that out. Any questions on the hierarchy?
Yes.
Okay. We got two. So sometimes when we're talking to people about when they're having trouble choosing a healthcare agent, we ask them to consider, if they've never themselves been a healthcare agent, some of the questions that you would want asked is, so what is the hoped for or anticipated outcome of this procedure or surgery or medication or device? What happens if we don't treat this? And are they eligible for palliative care or hospice? And I like to review the palliative care and hospice just a little bit. Some people aren't all that familiar with them. Palliative care is care that's designed for people who have chronic life-limiting diseases. That can be heart disease, diabetes, COPD, dementia, and it's designed for the treatment of symptoms, whether that's pain, if it's emotional, psychological issues that they're having around a diagnosis. And that is meant, it doesn't have to have an end to that. So that can start as soon as somebody is diagnosed with a disease. And then hospice is care that you can receive if you have a diagnosis where they say you anticipating that you have 6 months or less to live. And that comes with a whole team, right? They have nurses, I have a doctor on staff, social workers, care aides or bath aides, volunteers, chaplains, all of that. So it is something that people can be eligible for, but don't have to accept, but it can be a nice team support for somebody who's given a diagnosis. And it doesn't mean that somebody's going to pass away in 6 months. It can be that they live longer and they're still receiving that care. Is that clear? Any questions on palliative or hospice? Okay. So back to page 1. So making sure that this is filled out with the most up-to-date contact information available. You don't have to list an alternate agent, but it really is strongly recommended. If you don't have an address for them, if you don't have, fill it out to the best of the information you have. If you know the city and state they live in, whoever pulls this up, especially at a hospital, will do their best to locate that person. And that relationship you see on there, they list relationship. That's important for the person making that phone call. It helps them understand who that person is to you. And then at the bottom, you'll notice this paragraph, situations that may apply. And if they do apply, you just initial to the left of it. If they don't apply, you can draw a big X through that. Then they know that you read it and you chose not to fill it out or it didn't apply. So the first one is, if I name my spouse or registered domestic partner as my healthcare agent, we later file for dissolution, annulment, or legal separation, I want them to continue as my healthcare agent. And sometimes we see people file for separation, and that might be just because they want to be separated, or maybe they're doing that so they qualify for some financial program. And they may just want that person still to be their healthcare agent. Maybe they're still the best of friends. The second one is, I am not naming a healthcare agent. By sharing my goals and values in this form, it will be considered a personal value statement and not an advance directive. So we don't recommend that, but there are people who really feel that they don't have anybody to name. I am here in the Columbia network in Vancouver and Longview. And we do have a company that that allows themselves to be named. They don't charge for that until the time comes that they may be called to be in that role. And they call their clients every year to review their advanced directives. So I can ask Hillary if there is anybody up in your area that does that as well. Attorneys can do that as well, but you would want to make sure that they understand what you want. A lot of times there's changes in staffing, and maybe it's not really well written and they don't know you as a client very well. So that's page 1. Page 2 starts preparing the healthcare agent. And the first part of it is, what matters most to me? I know that when I was filling out my first advance directive years ago, this part was a stumbling block for me, because I thought, what if I forget something or someone, or what if I forget to name something? There are tools out there on the Conversation Project. You can call Peace Health Advanced Care Planning and set up an appointment if you're a Peace Health client to have somebody walk through one-on-one with you. Or if you have your own different healthcare company, there's usually a social worker that can help you walk through this. But the goal is because we can't name every possible scenario where we may not be able to speak and tell people what we want to present the bigger picture for our healthcare agent that we've named. So knowing what we love to do mentally and physically, how important is it for you to know who you are with and who you are? How important is it communicating with family and friends? This is one place where I actually worked with a woman who actually named 2 people that were not at all allowed to communicate with her or her family or have any voice in her care. And they were named in her directive. So you can write anything in this. So, and what does living well or a good day look like to you? So like, what gets you up in the morning? What gets you going? And then what do you value most in your life? So here we see things like, I want to be able to get up and make my own cup of coffee and read the paper and have a conversation with my family and friends. And at the end of the day, sit on my porch and have a glass of wine. So whatever that is, I love to garden. I have a prayer group that's really important to me. I have a faith community. Whatever those things are that you enjoy, this does not have to be a beautifully written poem or paragraph. It can just be things separated by commas or bullet points. Okay, I'm gonna look and see any questions. Let's see, let me make sure, when you said eligible for palliative care, let me go back to palliative care here. Did you mean eligible for Medicare coverage or eligible per a doctor's orders? If you have a chronic life-limiting disease, you would be eligible for palliative care, and you can get a referral from any doctor that you have helping you in your care. So it's just, symptom management. You don't lose your doctors with palliative care at all. It's just one person that can be the overall person that you're talking to about your goals of care and pain management and things like that, then can help facilitate that. Let's see, I'm an agent and I don't know how to determine if this person is eligible for palliative care. Asking the question. All you have to do is ask a question. So my mother was recently in the hospital and the hospitals came in and I actually asked that question. Is she eligible for palliative care? And she said, yes, she is. I'll make that referral. And it was that simple. How does a person get made into their directive? You would put that into the directive, saying that you have that on file, however that is written out, and you can attach a copy of whatever you've written out for that. And medical aid, it's made as medical aid in dying. We don't, because we're Peace Health and it's a Catholic organization, we can't facilitate that, but there are organizations in the state that do including End of Life Washington. They are a statewide organization that can help anybody with their wishes on that. So what is most important to me? And this can be truly anything. In my husband's, he loves red wine. And so in his, he has written that he loves red wine. And should he not be able to hold a glass or give himself red wine, he would like that drop by the dropper full in his mouth. Whether that could be honored at the time or not is another question, but that is in his directive. So it is what's important to you. Any questions on that? Okay. The second part is, what are my beliefs, preferences, and practices? So what gives you support, comfort, and strength during difficult times? What medical treatments would you want or not want, such as blood transfusions? How important is pain management? So we go into detail here a little bit about what does that mean that you don't want to feel pain, or how aware do you want to be? Do you want artificial feeding? And then how are healthcare decisions made in your community, culture, or family? We've met with some people where the person responsible for healthcare decisions is the oldest male in the family. And that's written in here, and it really helps healthcare teams understand what is important to somebody and what needs to happen or not happen. Again, here you might have a prayer group that you want notified, or a faith community. You like having your family with you at a bedside, if possible. Or you don't want that. You like light, or you don't like light in a room. You love music. I had one woman in here put that she loves music, but that if anybody ever played rap music in her room, she would come back and haunt them for the rest of their living days. So it does happen. And these are where you want those details about that. And you will notice underneath there, it says, I would like the following person contacted to support my beliefs, preferences, and practices. This is not power of attorney for healthcare. This is just that person who might know that piece of you about what's important to you that may not be your healthcare agent. So in mine, where I name my husband as my healthcare agent, I name one of my sisters as this person, because we were raised like twins and she knows exactly what I like and don't like. And that can be really helpful. Do they want a lot of people in the room? Do they not want a lot of people in the room? We have people who are members of AA and they want their advocate to be that person. So it can be anybody. You don't have to name anybody here, but you can if that is helpful. Let me go back to the chat here and make sure I'm answering questions too. Are doctors who work for Peace Health or Family Care Network able to prescribe their patients the prescription for MAID? No, they are not, but the organization for End of Life has a list of physicians that are able to do that. So if not, what are the options for getting a Dr. PA? Yeah, so End of Life Washington has, they are really an amazing organization. And they actually have volunteers who can help walk you through if this is something that you choose. They can be there for the family, just because, sometimes the unknowns are more nerve-wracking than some of the other pieces. So they are a great organization to contact. They have a website, End of Life Washington, that you can look up all of that. Go back here. All right. And any questions on that second part? about comfort and strength. I want to touch on that pain management. So pain management, I have people tell me, I don't want to feel anything at all. I want no pain. And then my question is, are you okay being sedated? Because most pain medication also makes us very sleepy. Is there a balance? And is that something that you want the person you've named as your healthcare agent and alternates to know? Like some people say, I want to be as aware as possible, but my limit for pain is a 7 or a 6, right? So it can be really helpful to have a conversation specifically about pain. So page 3, again, we're still preparing the healthcare agent. The first question is on CPR. So this is just a guide. This is not a legal part of the form. So it's a guide for preparing your healthcare agent. So the standard of care in Washington State is to provide all care to keep you going, including cardiopulmonary resuscitation to people if their heart and breathing stop. So that's law, is standard of care in Washington. So this part is designed to guide your healthcare agent and healthcare providers on whether to perform CPR if you are hospitalized, because this directive is for in-hospital care. So if I am hospitalized and my heart and breathing stop, there's 3 choices on here. I want it attempted, so no matter what, I want it. The second one is I want it attempted unless there's been a change in my healthcare and I have one little chance of living a life that aligns with the goals and values I've stated in this form and or discussed with my healthcare agent, or a disease or injury that cannot be cured and I'm likely to die soon, or little chance of survival even if my heart is started again. So it's kind of middle of the road. I want it attempted unless these things have occurred. And the last one is I do not want it attempted. And if you do not want it attempted, you do need to talk to your healthcare provider about having a post form as well. So those are the 3 choices. There is a CPR guide that was included in the forms that were sent out. And I really like this form. So if you have questions on it, it's really a good form to go over. So it talks about what is CPR and will it work for us, right? We know that CPR works best if we're younger, if we're healthy, if it started right after your heart stops. It is less likely successful if we're weak, elderly, or have a chronic disease. And it actually goes into the statistics of the results of CPR in the hospital. So what does it feel like? What happens? So this is just a guide for that. If you have questions, talk to your healthcare provider about CPR. We know that as we get older, our bones are more brittle. So typically we're going to be dealing with broken or bruised ribs, sternum. Family Care Network. Claudia, you asked, Family Care Network is different than Peace Health. I am not familiar with Family Care Network. So I'm sorry I can't answer that question, but you can sure ask them if they are. So CPR, any questions on CPR? Okay. This is the post form. So this is what it looks like for the state of Washington. and Oregon, it's pink or white with a pink border. It is meant to be completed with a physician or a physician's assistant or nurse practitioner with you. So that is it. To me, that is really important. We might know what we think we want, but we want to make sure that it's filled out correctly based on your wishes. So it is portable orders for life-sustaining treatment. It is meant for out of hospital medical care. Sometimes called a DNR order. It's appropriate for individuals who are seriously ill or frail, where advanced medical treatment may cause harm. I've also seen people who don't have any serious illness, but do not wish to be resuscitated. and they complete one. It has to be signed by a medical doctor, a DO, a nurse practitioner, or a physician's assistant, and the patient or their healthcare agent. So as a note, if you have an advance directive completed and it is on file, and you aren't able to have a voice in your healthcare, and maybe it's a really serious illness and maybe you're on life support and it's not something that you ever wanted, your healthcare agent can complete a PULSE form on your behalf. So just know that that's another advantage to having an advance directive on file. And then it's the only form that can be followed by emergency medical services in the field. And talk to your physician or your healthcare provider if you want one of these or want to talk that through. Let me go back to the chat here and make sure that if there's any questions. Oh, John wants to know, where can one get CPR training? I actually got mine through the fire department. They offered a class on it. And so they'd be a great resource for that. Red Cross is another one. Yes. Thank you. Thanks, Marcy. All right. Any questions? Oops. Any questions on the PULSE form? Oh, my video got turned off. The PULSE form also needs to be, again, placed in a place, usually a refrigerator, on the refrigerator, or if you are bed bound, it would be like in the room that you are currently living in, and very visible to somebody who would come in. And again, anybody who travels, I recommend making a copy of the PULSE form if you have one, along with your advance directive, and having it with you. And we'll talk about how best to make sure that those can get honored in other places as well. And again, there's a Walla card in that you can cut out on this form that was sent out. Catherine? You had a question?
Yeah. If you fill it out and you're feeling very healthy and good about life, but still, in your late 70s, such as I am, and then you put it on your refrigerator, and then later you sort of change your position. Do you need to fill out an entirely new form with your healthcare provider if your box that you select is changing?
Yes. Yes. So this is another form that is meant to be changed if you change your mind on something. This is really only a form that you would fill out if you want to limit care in some way outside the hospital. Most of the time we really see this for CPR, because emergency medical services, that's usually if they come up to somebody with no heartbeat and no breathing, they're going to do CPR. That's usually the majority of the medical interventions that they might be doing, any major medical interventions. So if you don't want treatment, then this is the form you would want. If you still want CPR, you don't want to fill one of these out because it distracts from care. So emergency medical services, one of the things they're supposed to do is do a scan immediately for any PULSE form that may be in the residence. So in that case, if you do want treatment, that can be a few seconds of delay.
Okay, that's helpful to know because the first box does say full treatment.
Mm-hmm.
Yeah.
Yeah. Well, and we see a lot of times care communities are requiring the residents to fill one out, whether they want CPR or not. And it just can be very distracting if somebody really does want medical care. And, sometimes there's other limitations that are filled out on this form. This form has two sides that maybe you're filling out, but you want CPR, but it's for any limitation in the care that you want outside the hospital. So yeah, it is definitely a form that you should talk to your healthcare providers about if you are interested in maybe considering that, or you definitely want to limit your treatment.
Thank you.
Yeah, thank you. Oh, yes, Betty, thank you. Will EMTs follow a DNR or just the post? They are only allowed to follow the post. Sometimes the post is called a DNR order, but the post form is the only form that they are allowed to follow. So you can have somebody in the house running around screaming, they don't want to be resuscitated. They don't want to be resuscitated. If this post form is not there, they are required by law to attempt resuscitation. Does that answer all the questions on post for now? And I know that, I think it was John that had asked about the medical bracelets. Everything can help. So, if you're in a car accident, you have a medical bracelet that says I have a post form, and whatever else you might put on that, or my healthcare agent is, that all can help, but this is the form that they have to follow.
Julia, I have a question. This is Julia. I am wondering, there's a lot of things in place that will trigger a person to do something. For example, when you renew your driver's license, they ask you if you want to be an organ donor, etc. So for the average person who's not historically proactive in their care, or maybe family members, are there any triggers in place, such as renewal of something, that would trigger a person to even not require them, but trigger them to think about this? Because if a person is not seeking this out or doesn't even know to seek it out, or they're not educated in that way, then you have these situations that you've already described happening. People that don't want to be resuscitated, they didn't know there were these forms, etc. So are there any triggers in place that would even, unless a person actively pursues this, is there anything to make them even help them even think about it? It's other outside of a hospitalization.
Yeah. Not many. The only thing outside of hospitalization would be a conversation, a follow-up with a physician after a hospitalization, or a new diagnosis. What has been, to me, very interesting, is we've been dealing with my parents' medical things recently, and it was for a while just my dad. And they really didn't talk about his post form. He was hospitalized with diverticulitis and sepsis and almost didn't make it. And it was us asking the hospitalist to have a conversation with us about the post form and possibly changing his wishes on that. So Julia, it's such a big issue because so many people don't know, and they don't know that this is the requirement outside a hospital to limit those choices. And I can't stress this enough, we all need advocates when we're dealing with healthcare, all of us. And sometimes, whether we don't have it or it's not available at the time, I think about everything that I know that creates those questions, right? Where at the time I could step aside with my mom and say, hey, do you mind if I ask about this? But most people wouldn't know to ask. So you're right. So it's just, there is nothing outside of the healthcare system currently that I'm aware of that would trigger a question about this.
I know at my last, I'm covered by Medicare, and I know at my last kind of wellness visit, the physician asked about this, along with, and he gave me a list of things to do, along with get this vaccine, get that vaccine, do this. This is one of the things. Consider an advanced care directive and what you want. And there was no health care issues that would suggest that I needed to do it immediately or soon. Just, this is something you ought to be doing. So I think it might be part of that Medicare visit.
It can be if the doctor is proactive. Those Medicare visits can be, there's so much they're required to check off.
Yeah.
But it is really important because the advance directive is in hospital care. The pulse is out of hospital. So you might have an advance directive saying, I don't want CPR, but nobody's told you about the pulse form.
Yeah.
So yeah. And John brings up a situation, says, when the client is terminally ill and at the home to die, a visitor was there when the person expired and called 911. EMTs tried to resuscitate. The form can be very important. Oh yeah, to ease the suffering of a client and loved ones. So it is very important. Hospice almost always will have a discussion about the pulse form. And if anybody is on hospice, and something good to put on the refrigerator is hospice usually directs people to call hospice, not 911. But when you have a friend there, that's, if they don't know, that could happen. So thank you for bringing that scenario up, John. This communication about this is so critical. I've known from the beginning when my parents filled out pulse forms that they had them. We've had discussions about them. It's not always easy to do. My dad wanted to talk about healthcare and an advance directive. My mother at the time did not. She's a retired nurse. And so she has a wealth of information, but we did meet about it and they were pretty funny. They were dressed all in black for it, and hung black crepe paper over their dining room light so we could have the chat. But it's really helpful to know and review. So these are forms, and Marilyn, this is one, I think it's just a good idea that if you have it, making sure it's on file, reviewing it at those annual visits, because sometimes what if you have changed your mind on something, but you just forget to mention it, or you thought about it 6 months before the appointment? Catherine, did you have a comment or question?
Well, actually, just to kind of thank you very much for all of this. We moved here 4 years ago and redid all of our legal forms, including the advance directives, but it was not nearly as complete or detailed as this. So I really appreciate knowing about this and plan to revisit my 4-year-old documents.
Good. I'm glad. Thank you for sharing that. Okay, so this is pulsed. That middle part of that page on 3 is life support. What are my wishes? And it's a very specific question. So if I am so sick or injured and I'm likely to die soon, or I'm in a coma and unlikely to recover, I want my healthcare agent to, and there's 4 boxes on here. The first one is use all life support treatments to keep me alive, even if there is a little chance of recovery. I want to stay on life support. So I want it no matter what. Second one is try all life support treatment that my healthcare providers think might help me recover. If the treatments do not work and there is little chance of living a life that aligns with my goals and values, I do not want to stay on life support. At that point, allow me to die naturally. The third is allow me to die naturally. I do not want to be on life support. If life support treatments have been started, I want them to be stopped. And the fourth is I want my healthcare agent to decide for me. And the fourth one, I don't recommend having that checked alone because it's a lot of pressure for a healthcare agent. There should be much more conversation around it. But if you check the second box, which is kind of middle of the road, right? I want it if they think this might help me recover, but I don't want to stay on it if it's not. Or I don't want it. You can also check the fourth box if you want somebody in your healthcare agent to decide on timing. So sometimes we have people who want their family at their bedside and want the opportunity for their family to get there if they have to travel. And then the decision on when to stop life support, what that timing is, would be up to the healthcare agent, as long as it's not out of the realm of possibilities for the hospital setting or long-term care setting. And in these, as CPR also, I always suggest that people put their reasons behind it, right? You can handwrite I want my family to decide on timing if this comes up. CPR, I had a gentleman who had 3 pretty serious chronic diseases, and he wanted CPR no matter what. And his reasoning that he wrote in there behind it is, I believe in miracles. And what that does is it gives your healthcare team and a reminder to family and your healthcare agent why you would have checked that box. It just helps them in the voice part of it, to be your voice.
Julie,
Does that
this is Julia again.
Yes.
Sorry, I have so much information, or questions. I put it in the chat. Can you clarify what you mean by when you say on
Yes.
5 people? And then my other question, well, actually more of a statement, having been a healthcare agent personally for 2 people, and me being one of 6 children in advocating for my mother, who she named me, is really one thing my mother didn't. She had a health directive, but she didn't really notify my siblings who that person was going to be. And so in the event of a medical issue, and we are a fairly cohesive group, but several of them had the understanding or the belief that I was making decisions on my own, my own wishes rather than our mother. So I would advocate, if you have more than one child, especially, that you're making sure that your children know who the designated person is, and then that they are acting upon your wishes from the health directive. It's not always cut and dried. There's still some gray areas, and I always discuss it with my siblings, but still, I think that's an important part of the conversation because, so you aren't almost accused of making decisions that were not particularly that person's wishes when they really were. So just throwing that out there.
Yeah, thank you, Julia. That is a really good point. Decisions around healthcare for somebody that, everybody loves can absolutely divide families. And having, when we say, make sure you share this with everybody who has some agency in your healthcare, right, or family, that means everybody, not just your healthcare agent that you chose, but as Julia said, siblings or anybody else that's really close. Everybody should know and have a copy of it. So like my siblings all have a copy of my parents' advance directive. They've all been there and present for these conversations. They've all had the opportunity to ask the question. So that is really, really important. And then Julie wanted me to maybe in more detail go into what it means to have it on file. And I'll cover this at the end too. That means have it on file with the hospitals in your area, have it on file with your doctor, have your family have a copy of it. Whoever is important in your world should have a copy of that. And you can make as many copies as you want. Just keep the original and keep it handy. Don't lock it up in a safe or a safe deposit box. And then I had a request to go through the example of this life support one and using that 4th box. So if you make a choice on your life support and say you want middle of the road, like try all life support treatments that my healthcare providers think might help me recover, and you check the 4th box, I want my healthcare agent to decide for me. After that 4th one, you could write something like, I want my healthcare agent to decide on timing for the removal of my life support. It's important that my family is by my bedside if they wish to be. And that just helps clarify for everybody why you would want the agent to decide on timing. I hope that's clear.
Could I suggest that if people have questions, in case we can't get them, because you agreed to an hour and we've already imposed on you quite a bit. If you have questions, maybe the safest thing to do is put them in the chat. And then if you're able to answer the questions while you're here, great. If not, maybe we could forward them to you.
Okay, that sounds good. I'll go through these last. So we're very close. So medicines used to keep you comfortable and ease pain, anxiety, and breathlessness are not considered life-sustaining. So
See,
just
I feel like you didn't wait to see if everything settled.
So if medicines, if you don't wish to have life support and you move from curative care to comfort care, care doesn't stop. They will still provide the care to keep you comfortable, ease pain, anxiety, and breathlessness. Okay, additional directions.
I think someone has their mic, their audio and their mic on it, and it's interfering a little bit. If you're not speaking, could you turn your mic off? Thank you.
Here, this part, do we?
Okay. Sorry to interrupt you, Julie.
Oh, no, that's okay. All right, so I'm gonna go ahead and, okay. If I'm dying and my medical care support system and resources allow, my preference would be to die. And there's these choices at my home, at the home of a loved one with hospice if desired, in a medical facility. I don't have a preference, or other. And this is, should that ability to choose come up, where would you want that to be? And we get everything. I get whatever's cheaper. I do get that. And I have to say that's most often from men. I don't care. I don't have a preference. I've had people say in a medical facility, but most people say at home. All right, the next page. And then on the fourth page, last page, additional directions. This we always laugh at because it only provides 2 lines. So please feel free to add an additional page or handwritten note. Any additional directions, like I am an organ donor, and the plans for your remains, or you have a prepaid funeral plan, or a prepaid place, or whatever that is that your wishes are. And you can also attach a copy of whatever those are to this advance directive. Sometimes that's helpful. Just something on life support. If you are an organ donor, life support would remain in place at least until the life support team would get there. There is also a dementia directive that Dr. Barack Gaster from University of Washington designed. It doesn't name a healthcare agent, but it talks about, if I should get dementia, this is what I would want. And it divides it into 3 stages: early, mid, and late. And it's very straightforward to fill out. And you can also attach that to this form as well. And that's available on that site. A little bit about dementia. We talk about dementia may not be covered because dementia is long, right? It can be really long. So making sure that you have that advance directive. Dementia is the #1 reason that people 65 and older do not have a voice in their healthcare decisions. So it is really, really important that you talk about it. And just because you've been diagnosed with dementia or mild cognitive impairment doesn't mean that you don't have capacity to help in your decision-making and filling out an advance directive. So know that. Don't be afraid of, if somebody has a diagnosis, that they'll say no, that you can't be a part of it. If you have capacity, you can still be a part of it. And that's really important. So this is where we get to the
Julie, can you elaborate a little bit on that? Because I know we're running out of time here, but it is kind of an important topic because my mother did have dementia, and she had this all in place before her diagnosis, but she actually had to be named by 2. In order, her wishes was to have a DNR order, and in order to activate that and be activated as her health POA, 2 physicians had to sign off on that diagnosis. This is in the state of Wisconsin. Had to sign off, and so I wonder, in Washington State, how is that proven that you now have the power if someone has a diagnosis of cognitive changes or dementia in the state of Washington? Because in Wisconsin, it took 2 physicians for me to be able to honor my mother's wishes that she had outlined and had discussed with me. So,
yeah, so that is a really good question, and that could be a whole other hour. But in general, or 2, in general, here in Washington, people would have to go to the person diagnosed with dementia, to their physician, and have them declared incompetent to make decisions for themselves. That is a really hard thing to do. First, it's hard oftentimes for a physician to do that because most physicians don't want to put that in writing. And it's very hard to ask for that for somebody that you love, to say, I need them declared as incompetent to make their own healthcare decisions. But that is usually what's in general, what's required here. We don't need two physicians to sign off on it. It's just one making that statement. And
the good news for me was that I knew my mother's wishes because we had discussed it numerous times. And so I felt very comfortable. Not that I would want her to have that diagnosis, et cetera, but I did know her wishes well. So
yes, makes a huge difference. Again, the whole reason for having an advance directive is to make sure that your wishes are followed when you don't have a voice anymore or are unable to state what you want. So super, super important. And if you have that advance directive and you are that power of attorney for healthcare, if that person isn't competent to make their own decisions and you know that they wouldn't want to be resuscitated, you also have the opportunity to complete the post form for them and sign on it. So really, really important. This is the statement. So here in Washington, the requirements for signing are you have to have two witnesses independent. They can't be your healthcare power of attorney. They can't be a relative. They can't be your doctor. And then, or you have to have it notarized. We are all notarized up there in Bellingham. Lindsay and Hillary are notaries as well. And that can be notarized. We advise notarizing if you travel out of state, because some states require advance directives to be notarized, and that gives it a better chance of being honored somewhere else. Or you have a family situation where you know there's going to be issues. Having it notarized gives it a little more oomph to it than just having it witnessed. Less able to have it challenged, if that makes sense. And then once that's on, so this is in the slide. So they have to be 18, right? Can't be related to by blood, all of that. So this is what it looks like. So two witnesses, and they have to witness your signature at the same time, or a notary, one or the other. And then next steps, decide who your healthcare agent is. If you haven't decided, have a conversation with them and anybody else around them that is important to you. Complete the form, sign the document and have it witnessed or notarized. Make sure your name and date of birth are at the bottom of every page. Make copies of it, keep the original. Give copies to your healthcare agents, your primary care provider. Make sure a copy is on file with any hospital or clinic and where you receive care, and anybody else. So just like Julie was saying with siblings, make sure everybody has a copy. It is really important, really, if you can, to have a conference call or have these conversations together. And then think about other documents that you might want to fill out, like the dementia directive. Here is a picture of the wallet card. This has everything really that you need to have information on. So this is really a good idea to carry with you. And again, if you travel, it doesn't hurt to have a copy of your advance directive and post with you. And then continue the conversation. So these forms are meant to be revised, and we call it the 6 Ds. So at least every decade. As we get older, we say every 3 to 5 years. If there's a divorce for yourself or that of your healthcare agent, if there's a new diagnosis or a new device, if there's a decline in your health or the health of your agent, if there's a death, and whether that's the healthcare agent that you had chosen, or maybe somebody close to you has died, and it makes you rethink what you want or don't want for yourself. And distance. So if it's important to have somebody close to you, be your healthcare agent. If somebody moves away, that is a good time to review that as well. And that's the end of the presentation. And I can answer these questions really quickly if we, Zoom manager. Okay, let's see here. Okay, right. So it has to be witnessed by 2 people or notarized to be legal. The state of Washington advance directive, no. The state of Washington just requires the 2 witnesses or the notary. And who determines capacity in dementia cases? Normally the physician will do that. We have conversations about capacity in our roles, you know, where we're evaluating, and there's guidelines to follow on capacity. Can somebody repeat back to me with their understanding about where they are in like a dementia diagnosis? Can they repeat what's important to them? Can they give me their reasons for their choices? So there's, you know, it's a gray area, but, and it eventually gets to a place where it's not gray anymore, but there is a time when it is gray. So we try to honor those wishes when we can. Video clip. All right. Anything, where do I get the forms for this directive? So Mary Lynn sent those out, and I can send printed copies to her also. And the dementia directive is available on, if you look up dementia directive, it's there. He has a website on his University of Washington, Dr. Barack Gaster. Thank you all for staying and listening. That was, I didn't even notice how much time had passed. So thank you. And thank you for all your questions and feedback.
Yes, thank you so much. Yeah, I could tell that you got involved in just in your topic and forgot what time it was.
I did.
The time went by so fast. We very much appreciate it. Obviously, from the questions that you were getting, people who really needed this information. We're very happy to have it. I appreciate that you could take the time to be with us today and give us this information. Thank you so much.
You're welcome, and thank you all.